Hello everyone, my name is Neat Physio and welcome back to my channel, and this video is for breast cancer patients who are 12 plus weeks after any breast cancer surgery. This video is going to go through safe and suitable exercises from this 12 plus week mark, which means anything from 12 weeks onwards, and really the focus now is on getting you back to the sports or hobbies you enjoy. But first, a quick disclaimer: everyone has their own medical history, social history, physical abilities or cancer treatment program. So always check with a medical professional before starting any exercise, just to make sure it is safe and suitable for you. The other thing that's important to say here is we never want to push into pain. So listen to your body. It's okay to maybe be a bit uncomfortable or a bit of an ache, but if we're causing pain, we're probably slowing down your recovery because we're just going a bit too hard or too fast too soon. So how do you actually follow along? So you've got two main options really. We can either do the full exercise circuit as a full session, and you could do that at the absolute most once a day, or actually at this point you're getting back to things once or twice a week. Or you can pick 3 or 4 of the exercises and just intertwine it into your day. For example, if you are someone who's back at work, you might do 3 in the morning, a couple at work, and a couple when you get home. Really, it's what suits you. The other element is it depends on where you're at. So, for example, if you're someone that hasn't got full mobility, so taking the arm all the way up, all the way out to the side, all the way into rotation, or fully behind your back, then you really want to be focusing on that mobility, so getting that range back. So I would be focusing on those exercises, either the ones in this video or my previous videos. Reason being is if we don't get full range, there is a chance that you're going to get a shoulder problem in the future. So it's important to get as much mobility as you can. The other element of this video is building on that strength, because if you've got a particular sport that you're getting back to, whether it's yoga, swimming, CrossFit, whatever it is, your shoulder needs to get to that load tolerance, or otherwise it will get painful. Welcome to the exercise component where you can follow along in real time. We're going to start off on the floor because we're just going to warm ourselves up and work on that mobility, and then we'll progress to strength. So we're going to start off with gentle shoulder rolls, but including in that breathing. So in for your nose, out for your mouth, to try and really get your lymphatic system working as best possible. So inhale, roll your shoulders up towards your ears. Exhale, back and all the way down. We're going to do 5 each way. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Last one. And exhale and back the other way. Inhale, back and up. Exhale, forwards and down. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. 2 more. Inhale. Exhale. Last one. And exhale. The next thing we're going to do is just work on our rotation and getting our shoulders involved, either with your hands on your shoulders or behind your head, and just have your elbows as high as you feel comfortable. So you might start off lower down, and we're just going to do some nice rotations. So again, deep breath in. Exhale, just twist as far as you feel comfortable. Back to the middle. Inhale. Exhale. Back to the middle. 2 more times. Exhale. Lovely. 1 more time. And exhale. And relax. And then the final warm up is we're going to inhale, take our arms all the way up. Exhale, out to the side and down. And we're just going to do 5 here. So inhale, reach up nice and tall. Exhale, nice big circle. Inhale, up tall. Exhale. Inhale. Exhale. Inhale. Exhale, we've got 2 more here, and just don't go into pain. Exhale, last one, and exhale. So you should feel by now that your shoulders and your mid-back are feeling a bit warm and a bit active, and we're just trying to push a little bit of range to get you as best mobility through your shoulders as possible. Now we're going to move on to section 2, which is 3 exercises just to really push our mobility, and to stop us cheating, we're going to go against a wall. The first exercise is similar to what we did in the warm-up. We're taking our arms all the way up and all the way down as far as you feel comfortable. Inhale on the way up, exhale on the way down, 5 times over. Don't worry if your head can't get against the wall, just go as far back as you feel comfortable. Roof of your hand against the wall. Inhale and exhale. Inhale, exhale, inhale, exhale. 2 more times. Last one. And exhale. Really well done. The second exercise, I'm just showing you from a different angle, but find a wall or a door anywhere at all. Have your hand around about shoulder height, and all you're going to do is straighten up that arm and try and twist yourself away. And what you want to do is feel a kind of tightness here, and maybe even a little pull down the arm. That's a nerve being slightly stretched. And we're going to hold here for 30 seconds. So it's around about 5 deep breaths. So again, breathe in for your nose, out for your mouth, and we're going to do that 5 times. Are you ready? Breathe in and exhale. Inhale, exhale, inhale, exhale. 2 more times, and if needed, just pull a bit more into a stretch to twist your body away. Inhale, exhale, inhale, and exhale. Great, let's do the other side. So again, different angle, hand against the wall, shoulder height. Step yourself forwards, twist yourself away. Deep breath in, exhale, deep breath in, exhale, deep breath in, exhale. 2 more breaths, deep breath in, exhale. Last one, deep breath in, exhale, and relax. And then the last one here, roof of your hand against the wall. And the long-term goal is to do a full arc, which many people might never be able to achieve. So don't worry if you can't get there. Again, we don't want to push into pain, and we're going to do 5 repetitions, and we're going to add in the breath as well. So we breathe in as far as we can, exhale and down. So I'll show you. Inhale, exhale, inhale, exhale. And if you can go further round, inhale, and then you would exhale, or inhale, go as far as you can, exhale back down, last one, inhale, and exhale. And actually, if you need, step a bit further away from the wall, and it will just make it that much more achievable. Now we're moving into our final section, which is strength. And all you're going to need is some kind of resistance band or lightweight. I don't mind what you use. However, I've said it before, I prefer a band because it kind of stops us cheating a little bit, and it gives us sensory feedback so you can feel if one shoulder is moving a bit differently to the other. Whereas a free weight, often we can work with our most dominant muscles and may not see that there's a difference in the way that we're moving. So we're doing a couple of strength exercises. You're aiming to do 10 to 15 repetitions. However, it's absolutely okay if you're starting with just 5 repetitions. That's not a problem. And really the end goal is to slowly increase your repetitions or resistance. So it might mean going up with a different band, so a stronger band, or a heavier weight, or going from 5 to 8 to 10 to 12 to 15 repetitions. So we're going to start off with a row. All you're going to do is have your band on the floor, stand on the band and bend your back so that our back is flat, but our chest is over our feet. And you're going to have the band taut and try and squeeze up in between your armpits, so the bottom of your shoulder blade is squeezing back towards your spine. And we're going to do 12 to 15 repetitions today. Squeeze 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, keep squeezing, 11, 12, 13, 14, 15. Now, even if you've only had one surgery on one side, make sure you do the other side because you'll be surprised and it's good to see the difference. So we'll do the same today. Stand on your band, bend yourself forwards, nice flat back, chest is tall, look up in front of you, squeeze 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, don't worry if you can go slower, 13, 14, 15. And the key focus on this one is squeezing those shoulders back, so we're really engaging backwards. The second exercise is very similar. It is a bent over fly. So again, you're standing on your band, bending yourself forward so that you've got a nice flat back, chest is tall. This time the band's going out to the side and down. You'll want a bit more laxity on the band, or again, you can do this with a free weight. So 1, 2, 3, 4, 5, 6, go slow and steady, 7, 8, this one's harder, 9, 10, 11, 12, 13, 14, last one, 15. You'll really start to feel that your shoulder is aching after doing that one, so start with lower repetitions. Same on the other side again, standing on the band, bending yourself over, back is nice and flat, a little bit more give in the band, and again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, almost there, 11, 12, 13, 14, 15. Really well done. If you find doing that exercise is putting too much stress on your back, you can absolutely do it stood up nice and tall. So for the first exercise, you'd have the band out in front of you. Keep it nice and taut. Squeeze in and back out. Squeeze in and back out. And for the second exercise, exactly the same position. Have the band a bit more lax. And you're pulling out to the side and in. Out to the side and in. The only thing I'll say is that is a lot easier, so you might need to do more repetitions to get the same results. So the third exercise then, having your band slightly taut or just 2 little weights in your shoulders, we're going to do a shoulder press. And again, 10 to 15 repetitions, but if you need to, start with 5, start with 8, whatever works for you. And we're just going to go nice and controlled, push all the way up, push all the way down, push all the way up, all the way down. If this is quite easy, then, and only with the band, you can't do this with the weights, you're going to push up, behind your head, push up, in front of your head. It's a lot harder, trust me. and you'll feel it in your shoulders. So don't worry if you can't. Keep going. We're almost there. Push up and down. Push up and down. Almost there. 5, 4, 3, 2, last one. And definitely by now you're going, ooh, my shoulders, I can feel them. So the last 2 exercises with a band, and then we've only got 1 more to finish. We're going to do a front and a lateral raise, but we'll do them separately. So a front raise is just taking the arm to shoulder height and down out in front of you. And a lateral raise, as the name suggests, is the same out to the side. Again, you can do this with a free weight or a band. With a band, hold the band at your opposite hip. Nice bit of tautness. And again, we're going to work towards 15 on each side. 1, it's harder than it looks. 2, 3, really think about not shrugging your shoulders up towards your ears. 6, almost there. 7, 8, 9, 10, 5 more. 11, 12, 13, 14, last one, 15, and the same on the other side. So stabilizing at the hip, 1, and again, don't let that shoulder shrug up towards your ears, and don't let your back arch. 5, 6, 7, 8, 9, 10, almost there, 11, 12, 13, 14, last one, 15. And the last one is that lateral raise, out to the side and down. So again, stabilize at the opposite hip. A little bit more laxity on the band because we're a bit weaker in this position. 1, 2, 3, 4. And again, no shrug in the shoulders, no bend in the body. Just keep that shoulder still. 7, 8, 9, 10, 11, almost there, 12, 13, 14, last one, 15. Great, last time with the band, and then we finish with a little bit of a gentler movement. Same thing, 1, 2, and don't go any higher than shoulder height. 4, 5, 6, doing really well. It's hard work. 9, 10, almost there, keep going. 12, 13, 14, and 15. Boy, will your shoulders be aching a little bit, but it's a muscular ache, which is a good thing. That's where we're going to get growth and development. So there are your exercises for the future. They are hard, so don't worry if you can't do them all, or you need to really scale the repetitions or the resistance, or even doing it without any resistance at all. We never want to push into pain, and it is going to take time. Strength takes at an absolute minimum 6 to 8 weeks, which means you won't see any real improvements until around about 2 months after starting these exercises. So patience is key. But each week you get a bit stronger, you can do a bit more, and just mix and match. If doing them all in one go is too much, you really only need to be doing this 2 to 3 times a week. If you do it more often, that's absolutely fine. Or if you do it less often, that's also fine. It's just working at a level that's suitable to you. And if needed, break them up. You could do 3 every single day. Not a problem at all, but it is a mixture of getting that final bit of mobility and now pushing strength so that you can do everything you enjoy at home without causing pain.